What hematuria test should I expect? If you notice blood in your urine, it can be concerning, but understanding the testing process can help ease your worries. When a healthcare provider evaluates hematuria, they start with simple, reliable tests to find the cause and check your bladder and kidney health. The first step usually involves urine tests. A urinalysis is the most common and straightforward test. You'll provide a urine sample, often collected in a clean container, which is then tested with a dipstick for quick screening. If the dipstick shows blood, the sample is examined under a microscope to confirm the presence of red blood cells. Usually, at least 3 or more red blood cells per high-power field indicate hematuria. The urinalysis also checks 4 other signs like protein, white blood cells, bacteria, or crystals, which can point to infections, kidney stones, or other issues. In some cases, your doctor might order a urine culture. This test helps identify if bacteria are causing a urinary tract infection, which can sometimes lead to blood in the urine. Urine cytology might also be performed, especially if there's a concern about bladder cancer. This test looks for abnormal or cancerous cells shed into the urine. Additionally, tests for urine calcium and protein can be useful to evaluate if kidney stones or kidney disease are contributing to the bleeding. Blood tests are also part of the evaluation. Serum creatinine and blood urea nitrogen tests assess how well your kidneys are functioning. If these levels are high, it could suggest kidney problems. A complete blood count can reveal anemia, which sometimes occurs with ongoing blood loss or signs of infection. Complement levels may be checked if an immune-related kidney disease like glomerulonephritis is suspected. Imaging tests provide a visual look at your urinary tract. An ultrasound of your kidneys and bladder is a non-invasive way to spot structural abnormalities, stones, or tumors. If more detailed images are needed, a computed tomography scan, often done with contrast dye, can give a clearer picture of the urinary system. Magnetic resonance imaging may be used as an alternative, especially if contrast is not suitable for you. A key procedure is cystoscopy, where a thin tube with a camera is inserted through the urethra into the bladder. This allows your doctor to directly examine the inside of your bladder and urethra, helping identify tumors, inflammation, or other issues that might be causing bleeding. In rare cases, if kidney disease is suspected and other tests don't provide answers, a kidney biopsy might be performed. This involves taking a small tissue sample from the kidney for detailed examination. The specific tests you undergo depend on whether the hematuria is visible to the eye or only detected through lab tests, your age, risk factors for urinary tract cancers, symptoms, and overall health history. For example, visible blood often prompts a more urgent and thorough evaluation because it can be associated with more serious conditions like bladder cancer. In summary, expect an initial urinalysis with microscopy, blood tests, to evaluate kidney function and overall health, followed by imaging studies such as ultrasound or CT scans. Your doctor may also perform cystoscopy to directly view the bladder. These tests work together to help identify the cause of hematuria, whether it's a benign issue or something more serious like bladder cancer. Always consult with a healthcare professional for personalized advice and diagnosis, as each case is unique and requires careful evaluation.